Testing. All right. Good afternoon, everybody, and thank you so very much for joining us at the InMode Symposium. We're running 20 minutes late because of the previous session, but this session will go until 1:20 p.m. We have an amazing, excellent lineup of speakers for you. And the format of the day will be as follows. After every speaker finishes their talk, they will be taking the stage, and then I'll be moderating questions and answers if we have time at the end. The first speaker, who is very, very near and dear to me, one of my mentors and teachers throughout the years, I've been studying his work and learning from him for, I don't want to give away his age. I mean, he looks super young and fit, but he's an old puppy and very experienced. So for more than 10 years, and he's inspiring, exceptional, and really one of my dearest mentors and friends. And he'll be speaking to us today on the Morpheus 8 and its use for acne solutions and a lot of combined protocols. Now, unfortunately, he's very, very busy and has a crazy schedule here, has other sessions, so he may not be able to join us for the Q&A. So only for Professor Artsy, I'm going to allow questions and answers for 2 or 3 minutes after his talk. So without further ado, one of the real educators of our time, who needs no introduction, dermatologist from Israel, and our very, very dear friend and mentor, Professor Ophir Artsy. Please join us.
So it's always great being here. Just the technical team, if you can put the video and not the demonstration so I can see what is going on.
I'll do it.
No, but I think that you put, again, what I see, just for you to know, I see the demonstration, someone is injecting. It's not me. I'm here.
It's coming up right now. There it is. It will start in 1 second.
And clicker, all right. So, until it starts, how many of you treat acne patients on a regular basis? That's it? All right. How many of you treat acne scar patients? Raise your. All right. This is one of the most common, I would say, call for a dermatologist. We want to know how to really treat acne vulgaris and acne scars, because many patients, we actually say that this is one of the most common skin condition, and 95% of the patient with acne will develop acne scars. Fortunately, 22 it's going to be very severe, 22%, but we have to know how to treat it. So how many of you use radio frequency for the treatment of acne? Just acne. Raise your hand. So I hope after my talk you all will understand that this is a must. Radio frequency devices in general, not just Morpheus, it is known for years for the improvement of skin quality. So we talk about improvement of skin texture, making the skin more smooth, tighten the skin, and it is known that you can use it for different skin types, including Fitzpatrick. You can see the publication, even Fitzpatrick type 6. I'm telling you, for Asian population, this is the device to be used. Now, let's talk about radiofrequency and acne, or follicular disease. First, there are publications to show that whenever you perform fractional radiofrequency, you decrease the pore. You suppress the sebum production. Actually, there is one study that showed that if you perform 3 consecutive treatment, you will have 42.18% reduction of sebum production. This is a beautiful study by Professor Hellman from the States, and she showed that just by performing fractional radiofrequency, you actually suppress the inflammation. You can see the markers, but mainly we talk about the NF-kappa beta pathway. So you have to understand that this is the reason that with different companies and with different devices, and this is just studies in the last 5 years, there are so many studies to support the use of fractional radiofrequency for acne vulgaris. If you haven't tried it, You have to try it, okay? And this is kind of the most common, I would say, treatment that we perform in the hospital and in my private setting. We use Zimmer because it's not very pleasant, and we perform the study, and you can see after 2 to 3 treatment, you can actually, nowadays, I have to say that I even go lower with my energies, lower than this one. Have a look at the changes. Again, before and after, dramatic changes that can be seen only with monotherapy of fractional radiofrequency. Now, whenever you talk about acne and acne scars, I will always refer you to this publication. I initiated this project years ago. It was published in 2021, but it took us 5 years to reach this consensus. You can see the names. These are the biggest names in the market. And in this publication, we tried to see the value of energy-based devices for acne vulgaris and for acne scars. Now, have a look. This is 2021. 90% of the panelists, this is the biggest names in the field of acne vulgaris and acne scars, they support the use of fractional radiofrequency and medications together. Now, how many of you use fractional radiofrequency with isotretinoin? On patients with isotretinoin, raise your hand. So maybe you are very puzzled or you're very concerned because of this FDA warning, which is based on 3 case series from the 80s, all right? Many years ago. Some of you weren't born still, all right? If we go and we see the current literature, and I have to show you this 2017, look back, this is a survey, a systematic review by the American Society of Dermatological Surgery, and without getting into details, 32 publications, 1,485 procedures, they came into the conclusion that actually there is no reason to delay fractional radiofrequency on patients with isotretinoin. Now, since this publication, there have been so many publications for energy-based devices on patients with isotretinoin. This is IPL, this is low-level laser therapy, this is 50-50 nanometer laser, again 50-50 nanometer laser, this is 1064, this is PDL. This is our publications, I will not get into details, in which we actually treated half side of the face on patient on isotretinoin, CO2, fractional ablative CO2. Have a look, you can see this is the average, okay? So the number, this is the control, this is if you treat together, this is if you treat separately, you have less, you see this is the number of acne scars. So you have much less scars if you do it together. Now let's go to Morpheus, all right? 3 arms. If you treat together fractional on isotretinoin, you will have 36%. This is objective measurement of acne scars. If you treat it separately, you will have 22%. And if you just prescribe isotretinoin, you will have only 9% reduction of acne scars. What does it mean? This is a standard care. So whenever we have patients in my hospital or my private clinic, we prescribe, and of course, if it's needed, we prescribe isotretinoin. Usually we go with the low dose, not because of the fractional radiofrequency, because we think it's safer. So it's either 20 milligram or 30 milligram, either every alternating day or per day, and we perform Morpheus treatment. You can see the result, and it's great, even better for truncal acne. Now, what about acne scars? I promised you that if you treat with Morpheus on patients with isotretinoin, you will have less scars. But let's talk about acne scars in general. if you want to treat acne scars, you have to understand what you treat. So you know acne scars, which are, let's say, flat pigmented macules or erythematous macules, should be treated differently as compared to hypertrophic papules of acne, or if you have the atrophic and different atrophic scars. I refer you again to this publication. In this publication, we all agreed that energy-based devices are the mainstay for the treatment of acne scars. Which ones? We think fractional ablative CO2 laser or fractional radiofrequency. They are the most important tools while treating acne scars. However, we didn't actually talk about which fractional radiofrequency. Now, I will tell you that different devices, different fractional radiofrequencies, will actually lead to different results. This is backed up, and this is acne scars with Morpheus. But I want to show you how we do it in the hospital and in my private clinic. Now, how many of you have seen the new Optimus Max? Again, elevate your hands. This is a different league of platform and device, and the Morpheus 8 burst again took it to the next level. It has new GUI, and generally speaking, and without getting into details, you can choose different, I would say, handpieces, different tips in order to really maximize your result. The energy per pin and the propagation of the energy will actually govern your result. And as compared to other devices in the market, you have much more energy in a very nice and homogeneous distribution, and this is translated into 5 times more energy per area, and in the end, better result. Now, I use it for different indications. We're not going to get into details because I want to focus on acne scars, and I'm using either, it depends for which indication, but for acne scars, mainly I like to use the Morpheus 8 burst. By the way, for acne, I know that it's kind of off-label, but I like to use the body. Okay, I think the propagation of it is better. You can use it with different modes, so you can use it with cycle, fix, burst, and scale. I'm sure it's going to be covered by other speakers, but you have to understand, whenever you have the needles getting into the skin, you can deliver more and more heat to have, on the one hand, anti-inflammatory effect, and on the other end, to have kind of a collagen production, overstimulation of collagen fiber and elastic fibers. Now, I use mostly the fixed mode for acne scars, and I want to show you how we do it. Always first, I start with what we call surgical procedure. So I do it 6 weeks before. Then, if it's needed, I do cross TCA. I use either this technique that I described, the painting cross TCA, or I use it even with a brush. Then we really like to I use hyperdiluted radius. We published, you see the curve. Years ago, we published this one. This is with radiofrequency. If you do it, you actually have at least 25% more result. So we subsize the area, the rolling-like scar, and we put deposits of, in this case, is hyperdiluted radius. If we do not want to use radius, I use different product, and I like to use the pneumatic needle-free ejection. And then I do the Morpheus. You can see the setting. I have really good result. Again, you can see here the area was excised. You can see this point. So the punch excision. Again, you see another result. And the last case that I want to show you is this case, because I think it represents your population. This is a guy, half Indian, half Moroccan. You can see the skin type, hyperactive, oily skin, and large pores, severe disfiguring acne scar, this is, as far as I'm concerned, the best candidate as compared to, let's say, Swedish, Caucasian acne scar, in which probably I will use CO2, all right? But for this one, this is the best candidate for Morpheus. So let me show you. In this case, we didn't need to have punch excision, but we wanted to do subcision and use the inverted pyramid technique to inject the hyperdiluted CAHA. And then we did the Morpheus treatment fix. You can see I use usually, if I have really deep scar, so first I use the prime focally, okay? And then on top of it, I use usually the body tip, but again, you can use different tips. Again, 2 layer, 3 and 2, and have a look. This is after 3 sessions. The photos were taken 6 months after the last session. Wait, always wait. So you can see this patient from this angle. You can see the dramatic change from this angle. And I will take the advantage in this stage to invite each and every one of you. The largest scar treatment conference will be held. It's held once a year. Actually, last time was in Bangkok. The next time is going to be Milan. So you're all invited if you really want to learn how to treat scars, any type of scar, acne scar, stria, with Morpheus, with combination, you're more than invited. Thank you so much.
As usual, beyond fantastic. Thank you so much for sharing these tips and tricks. Do you have some time for questions before you go? Okay, before I ask my questions, I have a couple. Anybody in the crowd have a question? And if you do, please come up and just ask it here at the microphone. You showed a pneumatic injection device. Just out of curiosity, were you using CAHA in that device? Not CAHA.
Not CAHA.
Okay.
So regarding the pneumatic needle-free injection, I tried all different products in the market. CAHA is not, it's not ejected. It's getting stuck.
Okay.
So what usually we do is usually I use some regenerative AJ. So I use either Profilo or Allura nowadays. I have to say, I started using polynucleotides.
Okay.
I have great results.
Nice.
So I tried it with Rajuran, Plinest, and Polyfill. So I inject it, and on top of it, I do the fractional radiofrequency.
Exactly. So the fractional radiofrequency is done after.
It's after.
Okay.
It's after.
Amazing.
After.
Phenomenal results, especially in the last patient as well. And
This
you didn't
is,
do.
Fadi,
you didn't, yeah.
This is, I'm telling you, we have to really perform a study, but this is the patients. So whenever you have, first skin, I told you Swedish, but it's just out of to explain you. This is, I'm going usually with lasers, but for the hyperactive, large pores, disfiguring scar, which we see in Asian population, mainly in Indian skin, this is the best result with Morpheus. So no competition, and I have only 70 devices in my clinic. No competition.
I've seen all the devices in your clinic. It's unbelievable, and it's very relevant for this population. Sherry, do you have a question?
Yes, I like your result with the acne scar, and on your setting, you are using 3 millimeter fixed, 2 millimeter. There's so many myths about fat loss with Morpheus. I just want to be open and ask you, do you see this in your practice using this setting?
I don't really encounter it, but I do have to say that the 3 millimeters are used mainly focally on the scarred area or on the scar, and mostly I use 2 millimeter. I invite, again, maybe we'll have time. Tomorrow I think we are going to have a demonstration. So yes. I will be more, I will try to elaborate more. With Morpheus, although it's very easy to work with this device, in the end you have to understand what you do. You have to understand the fix and the cycle and the burst and the scale, and you have to play with the different, I would say, tips and modes in order to maximize your result. So for example, for your question, if you do 3 millimeter and you do fix, 5 stacks in one place, that's a problem. So you really have to understand what you do. Sometimes if I do multiple stacks, I will decrease the energy, all right? Because especially sometimes if you want to have, let's say, anti-inflammatory, you don't have to have energy. You have you want to have more pulse duration, so I will use the cycle or the fixed, all right? And I want to have lower energy, okay? It depends on what you want to achieve.
Thank you very, very much, Professor. I'm going to have to leave it at that for timing, but we'll have a little bit of time at the end for questions. And so really in summary, very important with the Morpheus, you have to know how to use it. There's a lot of power in the machine, and what Professor Ofiartsi was saying is, when you want to do focalized stacking, you want to do it in the areas of the scar. You don't want to do, deep, high energy stacking everywhere else in the face, because that may lead to issues. Our next speaker is also a very dear friend of mine. She's a very talented dermatologist from Austria, and has been really a very experienced user of all of the technologies on the Optimus Max platform, which is a fantastic new platform launched by InMode that has a multitude of technologies and energies. And she's going to share with you her very creative and unique ways of combining a lot of the modalities off of the same platform in a protocol that's called InMode Boost. So Dr. Alma Kamenitsa from Austria, please come on up, and it's all yours.
Thank you so much. Thank you for the introduction, Fadi. So thank you for having me here. It's my pleasure to be here with you today. And as Fadi already said, today I would like to present you the InMode Boost protocol. We heard about InMode Boost as a combination treatment. So what are we combining? This is just shortly about me. I'm a dermatologist based in Vienna. I work in Vienna, and I'm also a KOL opinion leader for InMode. And I would like to present you the cases, the practical cases that I have been working on in my office on the other side of the world. The interesting thing is, this is a quote that I would like to show you the spirit of this presentation. So what I hear, I forget. What I see, I remember. But what I do, I understand. So it's bringing us to the practical stuff. What do we do when we come to our office? We are working every day with our patients. Let's start with this patient. I'm coming back to the patient. But how are we getting from one side to another? What are we combining? It's a powerful combination of the three energy-based devices, actually of the three technologies of InMode, Morpheus 8 Burst, Lumecca Peak, and Forma. We have to consider skin as something that we know what are we doing. We have to consider all the issues of the skin, because the patients coming to our office are asking for more than just the volume. They want to improve the uneven skin tone, the hyperpigmentation, the vascular lesions. So we have to try to combine everything what we have to improve this. So what are the indications for the InMode Boost protocol? If we start from the surface, as I said, pigmented lesions, vascular lesions, we can also fine wrinkles, the texture of the skin, we can improve the skin laxity, the sagging skin, and in some patients with heavy faces, we also want to reduce some fat tissue, excessive fat tissue. Good. Let's go back to the basics, because we have to know what are we treating. We have to know where are we when we are treating with Morpheus. Because it's a bipolar radiofrequency, and we are having the possibility to tailor our treatments, which means that we are controlling the depth that we are using. This is the first thing that we have to know. So if we take a look at the epidermis, there are a different thickness of the epidermis. So between 0.03 millimeters and 1.5. Why is this important? Because we have to know that 1 millimeter is not doing the same thing in a different areas of the face. So if I'm working at 1 millimeter around the eyes, I'm not in the same layer, in the same depth, and when I'm working on my cheeks or on the segmental area. So this is very important. Which cells am I having here? am I having an inflammation process? Am I heading for more pigmentation? So where am I working? This is important just to have it as a base. Where we want to work is also the dermis, where we want to get more stimulation of the fibroblasts, so more collagen, elastin, hyaluronic acid to have the better structure and the firmness of the skin. And if we need to reduce the fat tissue, to choose so, we need to go deeper and to stack our energy in the depth where we are addressing the adipocytes. So, the InMode Boost protocol, it's a protocol that is taking us on a journey with our patients. So it's nothing coming overnight. We have to give the skin time we have to give nature time to adjust, to build new collagen. 12 weeks protocol, 3 combination treatments of Lumecca Peak, which is an IPL device, and Morpheus 8 Burst, and 6 nutrients of Forma, which is a non-ablative radiofrequency treatment. I'm going to go into detail in my next slides. So, how we do it, how do it in the practice. First week, we start with a combination treatment. In the same session, we perform Lumecca Peak first for the surface of the skin, looking always for the reaction of the skin, which is very, very important to know where are your endpoints with your pigmented lesions and with your vascular lesions. After that, applying a topical anesthetic cream, at least for 60 minutes. And this is important because of the pain management. We're going to talk to that after this. But this is very important, like 45 minutes, 30 minutes, it's still painful. After that, we are performing Morpheus. Week 2, we are taking time for the skin to recover. And after that, to maintain, my patients are coming to the office in the week 3 and 4 for their Forma, non-ablative radiofrequency. So we are maintaining the results or the process that we are in. The whole thing is repeating again for 3 times for the whole protocol for 12 weeks. Let's go into detail now. What are our options and why is radiofrequency microneedling system working for all skin types? Because we can tailor our treatments. We're having now the possibilities to go deeper for the handpiece of applicator of 24 needles. I'm going to show you the tips after this. To go now to 5 millimeters. And the new thing that we have that we can combine now also for the patient who have very sensitive skin, very thin skin, darker skin types, we are having a new mode that we can use. This is just an overview of the tips that we can use. Professor Fear already said there are 40 pin needles that we are using mostly for the body, as a body tip. Then the classic 24 needle tip. And then there's something that I like the tip that's like a prime tip, only 12 needles. We can go to the same depth as a 24 tip, but this is for very small, delicate areas around the eyes, around your mouth, sometimes on the scars, and the resurfacing tip. It's a tip that has a fixed 0.5 depth, is uncoated for the epidermis, for the surface of the skin. I like to combine it, and I will show you a case where the combination is working very well. Good. How does it work? If we isolate one needle, it's just to understand the principle behind it. We're working with radiofrequency and the heat. And as you can see, there are 3 thermal zones when we are working with Morpheus. In the middle, the red zone is the highest heat that we are stimulating, and this is the ablation zone. This is when we are starting to, or trying to reduce to reduce the stack the pulses and to reduce the fat tissue that we want. And then there are two other zones, coagulation and the non-specific heating zone, which is more for the coagulation, for the stimulation of the collagen. What is different than the other radiofrequency devices? As you can see here, the poles, the negative and the positive pole in the other devices is between the tips of the needles. So our heat profile is only horizontal. In Morphus, we have in the applicator head is a negative electrode, which gives us possibility to have more heat bulking. We are working through the different layers of the skin, and this is why the results are much better. This is something that we have to think of. A fiber septal network is the actual connective tissue that is connecting all the skin layers together, and it's three-dimensional. So this is something that we want to improve, get it thicker, get it firmer as a structure of our skin. The outcome, thicker epidermis and firmer septa. This is what makes the skin more firmer and looking better. So these are the operation mode. We talked about cycle mode, which means when we are working and having one pulse, we are releasing energy. Fixed mode is when we need to stack our pulses, which means we need to get more energy into one place. And this is where we are stacking the pulses. We are staying in the same place and releasing the pulses. Burst mode, as you can see, we can give more pulses in we can give energy in a different layers in one pulse, or a scale mode. And if you take a look, the circles are different size. Just imagine it's like a pyramid. We are giving the strongest, the highest energy below, and the more we are coming to the surface, we need to be careful with the heat. Why? Because we need to protect the epidermis, just for the side effects. Examples are the best thing to see how does it work. This is like you can see when I'm taking a 24-pin needle and choosing burst mode, I'm having the possibility to choose two depths. Here, 5 millimeter and 2 millimeter depth. What you can see, I'm delivering the energy of 20 in both layers. So I'm having 100% of the energy in both layers. If I'm taking a depth of 3 burst mode, look what is happening with the energy. If I'm taking 7, 5, and 3 millimeters, I'm delivering 100% of the energy at 7 and 5. But at 3, the device is automatically reducing the energy. Why? Because it's safer. Because it's safer for the patient. Scale mode, same thing, but look what happens with the energy here. We are delivering only 30% of the energy the more superficial we work. When do we use it? How we know I'm choosing fixed mode, burst mode, scale mode? We have possibilities to play, but also to tailor our treatments. So, fixed mode, we can use it for all skin types, and basically when we are targeting subcutaneous tissue, submental area, jawline area. Burst mode for more thicker skin or patients with a very high pain tolerance, and in the skin type 1 to 4. Scale, which I'm having a possibility to work more with a more sensitive patient, very thin skin, patient with very low pain tolerance. This is where I am choosing scale mode, and also on the skin type 5 and 6. Why? Because they're prone to develop more post-inflammatory hyperpigmentation of the mechanical or thermal energy. Can we combine? Yes, we can, and yes, we should. And this is the beauty of Optimus Max. We can really play with it. The next device, Lumecca Peak, IPL, I don't think that I have to explain that a lot, but why is Lumecca Peak different? Lumecca Peak, we are having here 2 handpieces, 515 and 580 nanometers. So for the skin type 1 and 2 and 3 and 4. What's different than Lumecca? What changed? As you can see here, the peak power, and that's the power that we can release, is much higher in a shorter period of time, which makes it more powerful, and we need less sessions. How does it work? What is the principle behind it? It's a selective photothermolysis. We know that IPL devices are working that way, that they are looking for the chromophores, which in this case are melanin oxyhemoglobin, and they are all addressed between 500 and 600 nanometers, where Lumecca Peak is working. So through the absorption of the energy, we are having a heat generation and then destruction of this tissue. So, do you know pigment? As a dermatologist, for me, it's very important that we know what we're treating and what we are not treating. This is very important. As you can see, melasma is something that can go good or go wrong. So melasma is always something you have to tippy-toe around, and you have to have your extra medication regime. What I want you to know, lentiginous solaris and lentigo maligna, if you take a look, you cannot tell. Okay, so if you're not sure, let the pigmentation get checked first. Yes, 2 minutes, okay. Vascular lesions, this is what we can treat. So, Informa is a non-ablative radiofrequency, not painful. Patients come for maintenance. So I'm switching further to the cases. Coming back to this lady, 38-year-old young lady from Spain. You can tell she was a long time on the beach, and we started with the protocol. The first picture was taken after 1 month after the completed protocol. And this is very important that you are going to see the results at least 3 months after the completed protocol. The second picture, she sent it to me from Barcelona, and I was wow. So she really improved a lot. The next patient, also a young lady, before the treatment, 1 month after, 3 months after, and then 12 months after. What is important to know? We see it from the profile. Her jawline, the submental area improved a lot. And we see after 12 months that the results are very good, but this is where our actually patients coming back because they are coming for maintenance. The next patient, young patient of mine, he lost 22 kilos in 4 months. And you can see he improved a lot, especially in the area of the mid-face. Next lady. Next patient, also a very heavy patient, heavy skin. On the side, we can see the improvement. I'll just go through the cases. And we talked about that. Also today, InMode Boost protocol can also be done on the patient with acne scars, not only aesthetic patient, but medical patients. Here we are in process. So we did the medication therapy. Until now, from the picture number 1 to the last picture, we had only 2 Lumecca treatments. The next steps are morphous and resurfacing tip, yes. So I'll just want to tell you this is going to be a very big impact on your practice, and don't forget that this is bringing a lot to your patients where you can tailor your treatments and have better results. Thank you.
Beyond phenomenal. Thank you so much. Please have a seat. There'll be a couple of questions. No problem at all. So the next speaker is a plastic surgeon, also a friend of mine from Australia. Her name is Dr. Lisa Friedrich. She's just been, rolling through the technologies on the Ignite platform. She's going to share with us a lot of information about some of the new capabilities available on the Ignite platform in utilizing bipolar radiofrequency in the face and in the neck. Dr. Friedrich, I'm just going to upload your talk. You have 15 minutes, and We have to be a little bit on time because I have a quick talk after, and then I want to leave some time for questions and answers. It's all yours.
Good afternoon. Good afternoon, everyone. Thank you for having me here. Now, okay, so I'm going to talk about the Ignite platform, specifically the Quantum 10 and the Morpheus 8. You've heard a lot already about Morpheus 8, so there'll be some reminders here, but we'll skip through some of that. So I am a KOL and trainer for InMode in Australia, and I'm on the faculty of Allergan Medical Institute in Australia. So our two handpieces, we have the Quantum RF, which is an internal bipolar radio frequency, and the Morpheus 8, which you've been introduced to. Now, the Morpheus 8 is an external to internal bipolar radio frequency device. As you've heard, it is a little bit different from some of the other devices around because all of the internal pins are positive. The base plate that sits on the skin is negative. So not only do we get the sharp injury at the skin, we get a 3-zone radio frequency heat deployed at the pin tips. And then as the current diverges from positive to negative, we get heat through our tissues. So we get volumetric bulk heating. We get to set the depth by what we're aiming for, the target. So we can go 0.5 millimetre to 5 millimetres for the epidermis, the dermis, the fat, and the fascioseptal network. What's important here is considering again the depth of the epidermis. As Dr. Alma pointed out, there's no point doing a standard throwaway treatment without considering that if you're treating beyond 2 millimetres in the face, you're missing you're just going into fat, so there's no point doing that. The tips have been explained. The main workhorse is the 24 pin, which goes 1 to 5 millimetres. They're 30 gauge or 0.3 millimetre pins. They have the burst and the scale technology, which has been explained. The prime for small areas, and the resurfacing tip, which is probably underutilised by many, but I think exceptionally valuable in the face because it's 0.5 millimetre. Our Quantum 10 handpiece. So revolutionary new design. It is a 10 centimetre probe. There is a 25 centimetre for the body. It's got a 2 millimetre diameter, positive and a negative electrode, with a ceramic insulator between. It can exert 4 to 10 joules per pulse, and you can set the pulses per second, and then the technique that you use will also affect how much energy you're placing. So we get that movement from positive to negative, and it's coming out in an arc. The radio frequency thermal injury has been explained, so the key point is that we're getting a small zone of ablation, which is tissue destruction, right at that high density point of our positive electrode. Then we get that area around of coagulation, where we're getting denaturation, apoptosis. What that means is the cells are damaged. They're not killed immediately, but your body says, you're not working anymore, we're going to take care of you, we're going to remodel you. And that's why you'll hear people talk about the remodeling of fat. It's not an airy-fairy term, it's just that they are actually being remodeled. And then we just have this non-specific heating, where you're getting some other heat benefits. So when we think about our thermal energy, we've got to think about the total power we're putting in. And we have to think that the power is equal to the energy times time. So when we're thinking about the ablation and the coagulation, if we have a very high energy for a short period of time, that's similar amount of energy amount of power being delivered as if we go for a longer time but a lower energy. And the Morpheus and the Quantum are high energy for millisecond pulses, so they're more ablative. Sorry, that was the Quantum tip just coming in. So that's putting in, again, a 3-zone thermal injury, but because there's no external plate, there is not as much volumetric heating. Then we think about our energy and the level. So if you increase your energy level, you're going to increase your zone of injury. That makes sense. We see that with the Morpheus, and we see that with the quantum tip. If we have multiple level treatment, whether that is burst or scale or multiple passes, you have to consider overlap, confluence of zones, and of course escalation, because if you have an area of coagulation, that can escalate to an area of necrosis if there's too much overlap. And that will have an impact on your complications. The thermal relaxation time is actually something that is new for you now today. So this is the time it takes for the tissue to lose 50% of the heat that's been applied. And I think it's key to understanding how we use this technology. So although we can't actually set our pulse time on the Ignite platform, we can consider it when we're thinking about burst scale and fixed modes with Morpheus 8 and our pulses per second when we're using the quantum. So with a laser, if you have a pulse duration that is less than the thermal relaxation time, you keep your injury localized and focused. So you're going to limit the damage to surrounding structures. If it's longer, then you have a more extensive diffuse area of damage, which means you're going to have more damage to surrounding structures, which will be relevant for complications. So, as I said, we can't modify the pulse duration, but we can modify our settings and how we use it so we can apply this to get the results that we want. So we've been through this already. The cycle in the fixed mode, we can set the pulses per second. If we're going fast, we'll get more of an ablative effect. If we go slowly, we'll get more of a coagulative effect. The burst, as you know, sequential pulses, we're putting the same power out. This is capped for safety because we're going to get confluence of zones. In the scale mode, we do have a cap of power at 40, but it reduces as we become more superficial. So the applications in the lower face, we're going to be thinking about the laxity, the quality of the skin, the volume and contour, and the surface characteristics, so dyschromia, redness, texture. You know, here we have a young face, it's plump, the skin is fresh and youthful, and on the other side we've got, you know, a depleted volume, we've got dry, wrinkled skin that's lax. So quite a contrast. Now we can apply Morpheus 8 and quantum to both of these patients. When we're thinking about our targets and our heat effect, we know that we want the dermis, the fat, and the fascioseptal network. We know in general that we will get collagen denaturation with heat, and that will give us some contraction, and will activate wound healing. So we'll get collagen, elastin, and angiogenesis. We will get fat remodeling or destruction, which we can aim for or we can avoid in certain areas. Oops. Collagen will contract in that range of 60 to 70 degrees. Now, if we treat the superficial dermis at this temperature, we're going to get a burn. But we can treat deeper, particularly in the fascioseptal network, and that's where our quantum specifically comes in, because we can specifically go internally and target the FSN directly. Now, because the reticular dermis has a lot of dense collagen, you won't get as much contraction there. You will get a lot of contraction within the fascioseptal network, and so if we're aiming for skin tightening, we really need to make sure that we can affect that. So the Morpheus 8 will act from the dermis to the subdermis. It will give us direct dermal ablation and coagulation, but we'll get the volumetric heating. It's less direct contact with the fascioseptal network. If I'm treating someone at higher levels, I will often put some local anaesthetic in, and I do wonder if that does help some of the diffusion. We know with the face tight that we get a little bit more conduction of our heat when we have tumescence in the mix. The quantum will act directly on the fascioseptal network. We have less bulk heating, we've got less dermal effect, and so both of these together actually work synergistically. So just as an example, some patients and how I've treated them. Patient 1 is a 50-year-old woman. She's had about 50 kilograms of weight loss. So she had a lot of skin laxity. She did have a little bit of bulk, and I was initially cautious in treating her with the Quantum device, just because I didn't want to have any complications. So we did her lower face. We set our power on 4, and we didn't do a lot of pulses. We were very, very conservative. And in her neck, we did a lower power treatment. Now, you can overall see that she does have an improvement in both her skin appearance. We didn't actually do Morpheus8 on her, but if you look really closely, she's got some empty skin. Oh gosh, and what I found is that if we're treating with the Quantum, it's very effective at ablation of fat. So we are getting, we get some retraction of the fascioseptal network, but the sort of dermis has to catch up. And so I think the benefit of waiting for time, but also treating with Morpheus will improve the results. This patient had a previous Morpheus8, but he still had a lot of laxity. He had a bit of a turkey neck. He didn't have a lot of volume, a lot of dyschromia and texture problems. I'd initially treated him with FaceTite, and he had a buccal fat removal. Now, the lower pictures are at 8 months. Now, normally the peak with a FaceTite will be 8 months to 12 months. He still had a lot of laxity and some webbing in his submental area. So I treated him with 4 sessions of Morpheus8. I did a scale of 2 to 3 millimetres at 30, fixed 4 millimetres, times 4, and a 0.7 repeat, so a slow repeat. And then I did all over cycle at 10 with a fairly high overlap. And this is him 4 months later. So the most obvious thing you can see is the massive difference in his pigmentation and his redness, but also his webbing on his neck is almost completely gone. These are a close-up of his skin. He's had, as I said, an improvement in the texture, but also his fine lines and pigment. These are just some still pictures where you can see that his neck webbing has cleared up even more. Of interest, he's lost a little bit of weight. Now, rather than making his neck worse, it's not worse. It's actually stayed constant, if not improved, despite the further loss of weight. And just to finish, here's a lady that I did a fairly extensive Morpheus8 treatment with Quantum. So she's 49 years old, she's got rheumatoid arthritis, she's on methotrexate, she's had Belcara, she's got a lot of neck webbing. Now she's very thin, so I was initially reluctant to use the Quantum, but I thought she really needed some fascioseptal network retraction. This is actually, I'm using my Meta glasses here, so excuse the weird angle. You have to twist your head to get a good shot here. But here I am using, hopefully you'll be able to hear the cracks. I have put some tumescence in. Do we have volume? There's no volume, sadly. Very satisfying snapping where you can feel the energy. I'd initially started on very low power, but I actually put it to full power of 7 and delivered 369 pulses and delivered about, oh, here we go. You can hear it's a very satisfying sound, isn't it? Hopefully you'll be able to hear. No, that's okay. And then this is her Morpheus8. I gave over 1,000 pulses. I did deep in the areas that I wasn't using the Quantum on, specifically where we need to take care with the facial nerve. This is her the day after. You can see her webbing's completely gone already, and she doesn't have any significant swelling. So really amazing. So just in conclusion, I think this is a powerful device that delivers very impressive results, but you want optimum results and, most importantly, safe results. So I think my treatment has evolved by understanding the technology, understanding the heat effects on tissue, and then considering what I need to target in each patient. So I implore you to do the same. Thank you for listening.
Amazing. Thank you. Thank you very much, Lisa. That was really exceptional. Excellent description as well of a lot of the science driving our knowledge of RF, and excellent technique as well. It's a very powerful technology that has applicability in a wide range of patients. My talk will not take 15 minutes. It's a very practical talk, so I'll go through it in about 5 minutes, and then it's lunchtime after, but I see some hardcore users of our technology and people who are interested staying around, so I will extend it just for about 10 minutes after for people who would like to ask questions to our panelists. So I call it the power couple. This is a technology I use regularly in my clinic for hair indications. And it's really a very powerful and emerging technology that has been very, very popular in my clinic. Pathophysiology of hair loss is very complex and involves a multitude of reasons and issues and mechanisms. But what's happening most of the time when you see patients, especially in female pattern hair loss, is you have this ketogen elongation. So a lot of times what you're seeing is not the fact that the follicle isn't dead yet. You can actually revive it, especially in earlier hair loss parameters. And there's a lot of available therapies out there. This is not to claim that this is the only one, but this therapy that I'm going to show you, which is the combination of fractional RF in Morpheus and also the ASC plus hair exosomes, has become a phenomenal and extremely popular treatment in my clinic. And there is a lot of research and evidence to support this on a multitude of studies, histological, and also in terms of hair density. And why these particular exosomes? They are not from a human source, so it's very, very easy to get them accepted through regulatory authorities, but they have a very, very high concentration of the active ingredients with a very effective and symmetric particle size. So you get very nice diffusion and really excellent response from the patients. This is a study by Roy Geronimus from the United States, where he tried to claim that you are not able to create patent channels in your hair or in your skin when you use fractional RF. He said that only CO2 does that. But the problem with this study is he didn't describe what type of fractional RF system he was using. A lot of low ablative systems exist on the market. We know that Morpheus is a high ablative system. We just heard this. He also didn't look at the role of stacking the pulses. We heard from Professor Artsy, we heard from Alma, we heard from Dr. Friedrich as well, that stacking the pulses gives you a much bigger channel which remains patent and open further. So, but beyond just creating these channels that you can then apply your exosomes topically, fractional RF in and of itself is also very, very beneficial. And there's a lot of studies that show microneedling because of the mechanical effects, and RF having a very positive and stimulatory effect on the follicle. So here I'm using the resurfacing tip on the new Morpheus Burst. You can also use the resurfacing tip on the original Morpheus. I'm starting with a very low energy. Of course, the resurfacing tip is fixed at 0.5 millimeter, and I start my first few pulses with an energy of 8 directly into the scalp while I'm spreading the hairs so that most of the energy can go into the scalp. And there's actually no need for anesthesia, okay? It's painless. You just have to clean the scalp very, very well. Then I move on to a slightly higher energy of 12, and here I stack the pulses. So here I'll do a stack of 2 pulses to ensure that those channels remain open. And then I'm able to deliver my exosomes either topically, or in my jurisdiction, I'm allowed to actually inject them. And I have a prediction that we will soon be able to inject plant-based exosomes everywhere once the regulatory authorities realize that you're just injecting, growth factors and a meso cocktail. But it's a very powerful one. So I'm using the ASCE Hair Plus, and then injecting it using a 29 gauge cannula with small micro droplets at around 0.5 centimeter depth. And really, you have to understand that these treatments are adjunctive therapies, which means that they are there to support the mainstay treatment, which is therapeutically drugs. You have to give some sort of medicine in the background to try to get your accomplishment of the results. These are actually from Dr. Paul Han in Australia. You can see some phenomenal improvements over visits. This is actually Sherry. She's one of our staff, InMode staff in Australia. This is her husband. Am I right, Sherry? That's your husband. Look at that fantastic result after his 3rd treatment. Again, just excellent, excellent outcomes, even in temporal recessions. and really excellent growth of the hair and improvement. So I just wanted to show some of the results from different locales so people can know. This is my patient now. She's a 46-year-old. This is after 3 sections of fractional RF, just the way I showed you, energy 8, and then energy 12 for the second round of pulses, 100 pulses at energy 8, 100 pulses at energy 12, and then the ASCE plant exosomes. And you can see this after 3 sessions, almost a full regrowth of her hair. There's another patient that has actually a little bit more severe recession in the frontal, and she has actually now maintaining her results with minoxidil, and she's coming in for a treatment once a year. And this is a male colleague of mine who's also an InMode user. He's a plastic surgeon from Romania who tried everything and it failed. He tried microneedling with dutasteride, everything. Didn't give him the results that he got from the Morpheus plus the plant-based exosomes, and now he's also on minoxidil 5% foam. Another case as well, using the exact same protocol that I showed you. And so it's reliable, it's painless, it's minimally invasive, and it has become my go-to treatment for hair. I do about